Sports is important for keeping ourselves healthy, as the minister just said, but also, how do you make sports meaningful and purposeful? And one of the people that I've been inspired by is Anurag Thakur, who's used sports to mobilize resources for the Global Fund and brought together the whole BCCI and the team together to raise resources for the Global Fund. Thank you very much. Anurag Thakur is the former Minister of Parliament and Minister of Information and Broadcasting, Youth Affairs and Sports of the Government of India, and has been one of the most active members in global health. Thank you very much, Anurag, for being here. May I invite you to share with us your view?
Namaste, a very good evening to all of you. Shri Arjun Ram Meghwal ji, Honorable Union Minister of Law and Justice, Parliament Affairs, esteemed colleagues, distinguished guests, ladies and gentlemen, it is my privilege to address you all today at the World Health Summit Regional Meeting 2025. It is an honor that it is being convened on the Indian soil for the very first time under the theme, Scaling Access to Ensure Health Equity. So these days everyone is talking about markets and the equity, but as Meghwal ji earlier said, health equity. And see, Meghwal ji talked about equity and health, and we have the former Health Minister, Mr. Mansukh Mandviya, who have just arrived. Please put your hands together to welcome him. So friends, in an era where quality healthcare is too often seen as the privilege, as the preserve of the privileged, our gathering in New Delhi offers a unique opportunity to translate aspirations into action, to share lessons learned, and to forge partnerships that leave no one behind. India stands at the crossroad of challenge and opportunity. With a population of more than 1.43 billion, our nation has long grappled with the barriers of geography, poverty, and infrastructure. Yet over the past decade, guided by the vision of Honorable Prime Minister Shri Narendra Modi ji, we have undertaken bold reforms to democratize healthcare. We have moved from selective interventions to a comprehensive, citizen-centric model anchored by both financial protection and primary care access. In 2018, we launched the Ayushman Bharat Pradhan Mantri Jan Arogya Yojana, popularly known as PMJ, the world's largest government-financed health insurance scheme. If I have to give you the numbers today, about 55 crore, which is 550 million plus people in India are covered under this, can access secondary and tertiary care without out-of-pocket distress. As of 24th March 2025, more than 369 million Ayushman cards have been issued. To date, 83.9 million hospital admissions worth more than $15 billion have been authorized, sparing families catastrophic expenditure. Between financial years 2015 to 2022, government health expenditure rose from 29% to 48% of the total health outlay, while out-of-the-pocket expenditure fell from 62.6% to 39.4%, demonstrating our commitment to easing economic barriers to care. We have to talk about comprehensive primary care, recognizing that insurance alone can't achieve equity. We transformed our 150,000 existing sub-centers into Ayushman Arogya Mandirs, holistic health and wellness centers, delivering preventive, promotive, curative, rehabilitative, and palliative services as of 5th April 2025. $175,000 active health and wellness centers are operational across India, bringing care closer to rural and underdeserved communities. These centers have conducted more than 1.7 billion hypertension screenings, 946 million diabetic screenings, facilitating early detection of non-communicable diseases. Over 50 million wellness sessions including yoga, cycling and meditation have been held, emphasizing health promotion. Before me, Mr. Amitabh Khan touched upon the AI's part, artificial intelligence. I'm just going to talk about what India has done as far as the digital healthcare is concerned. During the COVID time, we had the convened app, Arogya Setu app. Apart than that, now we have the digital technology underpins our quest for equity. The Ayushman Bharat Digital Mission now boasts of 760 million Ayushman Bharat Health Account IDs, which are the digital health card. 559,000 verified health professionals we have in India. 386,000 registered health facilities. 520 million linked health cards ensuring secure, interoperable care pathways. We have seen the administration of the COVID vaccine in India, which was very, very successful during those times. These initiatives have translated into the measurable gains. India have achieved polio eradication in 2014, has reduced the maternal mortality to 97 per 1 lakh live births by 2020, a 75% decline since the late 1990s. Infant mortality has fallen to 28 per 1,000 live births, while life expectancy have birth now exceeds 70 years. These strides reflect our commitment to the UN Sustainable Development Goals, especially SDG 3 on health and well-being. When I entered, Soumya Swaminathan ji, she asked me, are you still doing programs of the tuberculosis? Yes, ma'am, I am still doing, because I think it is our responsibility in India, because we have the largest number of tuberculosis patients in India. So each and every one of us has to take care of that, create more awareness about it. And if I have to talk about some programs of the Government of India, more than 800 million people are given free food grains every month. More than 120 million toilets are being built. More than 130 million houses have been given potable water, the tap connections, to have the clean drinking water. All this leads to a better lifestyle, healthy lifestyle, and cut down the number or cut down the load on our healthcare system. If you look at the last 10 years, more than 250 million Indians have come out of the multi-dimensional poverty line. These all steps are taken in the right direction, but these kind of summits are very important to understand the project taken in your countries, by your organizations, by the governments and all, so that we can also learn from them. This is a platform to share what you have achieved, what you are going to do. And I'm sure whatever you have done in your respective fields, we all are going to gain out of it. As far as Prime Minister Modi is concerned, he has always talked about Vasudhaiva Kutumbakam, the world is one family. And his initiatives are always not only in the interest of India, but for the entire world. We have seen many of you raising hands from various, because you have traveled from thousands and thousands of kilometers to come to this part of the world. Let me first welcome all of you to our national capital, New Delhi. I hope you are all comfortable here. And this Bharat Mandapam has hosted the G20 meeting here, which was a very successful event after many years. India in the last 10 years have become the third largest startup ecosystem in the world. We have more than 157,000 startups today, 117 unicorns today, and we have seen hundreds and hundreds of startups are working into the healthcare sector as well. So I'm sure with the artificial intelligence, startups, and your expertise in various sectors are going to help us. We are sure globally the health tech market is predicted to climb from $106 billion in 2019 to $639 billion in 2026. As we have set a target for ourselves to make India a developed nation by 2047, I am sure healthcare is going to play a very important role. India is one of the largest pharma producers in the world. Indian doctors are renowned locally and globally as well. I travel across the world where we see in many countries where you have to find an appointment with a doctor. It may take a couple of months to find an appointment. But in India, one doctor can also have more than 300 or 400 OPDs in an institution like AIIMS or such institution, the government institutions. But at the same time, the number of medical colleges in India has gone up. It is double from 380 to 760 in last 10 years. The medical seats have gone double from 50,000 to 1 lakh. The PG seats have gone up from 31,000 to 64,000. So we are spending a lot in the healthcare sector, whether it is medical education or the healthcare sector. But we are all here to learn from your experiences. India, which has more than 65% as a young population, the youth here, we can be the world's largest skilled manpower. So kindly give various suggestions how we can partner together in the healthcare sector to provide the manpower not only for the healthcare but for the other relevant sectors as well. I won't take more time. We have a lot of speakers today. So distinguished guests, let me in the end thank Mr. Balveer Singh Tomar, who is the key to get this World Health Summit, the regional meeting 2025 to India. Thank you, Mr. Tomar, for all your efforts, and the NIMS University for putting in all the efforts. And let me thank all of you for coming all the way to India. Enjoy your stay. In the end, I would like to end up by saying the path to health equity is neither easy nor linear. But India's experience shows that determined policy, robust financing, and technological innovation can overcome historic barriers. As we scale access and deepen collaboration, let us affirm our shared vision, a world where no one is denied the right to health. Together we can transform promise into practice, ensure that the privilege of quality healthcare becomes the birthright of every citizen. Thank you for giving me time and listening to me. Jai Hind, Jai Bharat.